the president of the GHIG Medical Academy in Berlin. We have founded this academy in February this year, together with some Sudanese friends, Mr. Ibrahim Arabi and all the others who are still here now. And I'm very glad to speak about our academy. In the second part, I will show you some ways to go to Germany if you would like to work there, because in Germany we have a shortage of doctors, of nurses, and of medical technicians. And I hope I will see some of you, if it is possible, also later in Germany, perhaps in our academy or in the hospitals in Germany, in Berlin or in that area where I work now. As you know, Germany is a little famous for the healthcare system, and it is one of the best in the world. According to the ranking, it's the 4th place, not the other best, but the 4th place is not so bad. And Germany has also a very big tradition in healthcare, because a lot of Nobel awards, Nobel prizes went to Germany in the last 100 years. And Germany is also called the Hospital of Europe. Why is it in Germany so interesting for physicians? I think there are some facts you have to know. There is a tradition with a collaboration between science, research, industry, and medicine. And I think this collaboration is basic for the healthcare system we have in Germany. Germany is not so bad as you have heard it in the Second World War. Now I think we improved a lot. And I'm very proud to be a German because I only know this new area, not the old one. I don't know the Nazis, but I only know the new German politicians. Germany is also a very safe place, and we have no travel diseases, like in other countries. And as I told you, we have one of the highest quality of medical services in our country. In Germany, we speak not only German, but we try to speak English as myself, and we have a lot of other foreigners in our country, and also from the Arabic world. We have about 10% of both the Middle East and the Arabic world. That means if you come to Germany, you are in good company with other friends of your country or from the Middle East. We also have a very open-minded culture now, and I think that it's very good for you if you would like to work in Germany. Also, the climate is moderate. It's not so hot as here in your country, but the winter time is not so nice for you. We like it very much for heating, but I think, as I have seen with my friends from the Middle East, they don't like the snow and the cold. But it's only a few months, so maybe you can go during this time home to your country to relax here when you come back to Germany. Germany has also a status of rehabilitation. I think it's very important because we are one of the first and maybe only a few countries have rehabilitation after some surgery and so on. Normally, the patient goes home after surgery, and it is very difficult for special operations or for patients with special operations to have all the care at home. In Germany, it's possible you go to another hospital for rehabilitation, you are trained there, operation or something else. So let's come back to my academy, and I give you some slides about our academy, and then I come to the courses we have for you if you would like to come to Germany. This academy is in Berlin, in the capital of Germany, and we have all the values and visions you normally have for such an academy. And I think it's a little boring for you if you read all this, but it's only, I think, the basis for a good partnership and a good treatment of our patients and our customers. We make a lot of courses, and we would like to update physicians in all the fields which are available in Germany. You see it here now. About 30 subspecialties are possible to get in Germany, to receive in Germany. Also in Germany, there is a must for the doctor to have courses for continuing medical education, CME. It's the law. If you work in Germany, you have to fulfill some lessons each year to get the points that you are trained in the future in your field. It's called CME education. We also do this in our academy. So I think it's enough from our academy, and it's enough from me. The profile is written very small, so you don't have to read it now. Now we come to the point of this lesson, this presentation. Germany is organized in 16 states, and we call it the Federal Republic of Germany. I think it's similar to your country. We also have a lot of states here, and in Germany, each state has a medical office or medical healthcare, medical ministry. So that if you work in Germany, you have to apply at this local healthcare ministry or medical office to get the license you need to work in Germany. And it depends on the states where you live. For example, there are some slight differences between Berlin, where I live now, or Bavaria, or the other states. And you have to know it. And the healthcare system in Germany is founded by statutory contribution system that ensures free health care for all via health insurance funds. That means we have insurances and funds, and with these insurances, the patient's bill will be paid. 90% of the Germans are in this funds, in this insurance, and the insurance pay for the operations, all the treatment the patient needs. About 10% is for private patients. They have special insurances, and they have to pay it themselves if they leave the hospital. Now we come to a very special point, doctor's residency. Normally, the training for a specialist in medicine takes about 5 to 6 years and takes place in the university hospitals or other facilities, which has a license to train the doctors. The regulations for the specialist training are not uniform throughout Germany, as I told you before. And the responsibility lies within the regional medical association in the 16 German states. Prerequisite is the proof of very good knowledge of German language. This could be a problem for you when you come from red-speaking countries, and you must receive a special level of the German language. And to enter our courses for doctors, nurses, and so on, you need at least the level B2. B2, this level is formed by the EU and is adapted for the German country, for the German language. It's part of the European reference framework, and it is necessary to get a license as a physician and to get the approbation. We call it approbation, but normally it's the license in other countries. Now we come to the procedure. After completing medical studies, training as a specialist must be done in special areas, in special hospitals. And this training is about 5 or 6 years, and you can train in more than 30 subjects. For example, in surgery or in gynecology or pediatrician or internal medicine and so on. At the end of these 5 or 6 years of training, then you have to pass an examination. We call it state examination. But the point is, compared to other countries, during this time, these 5 or 6 years, when you work in the hospital or in other facilities, you earn money. You get the money from the owner of the hospital or from the state. And I think it's easier if you earn and you are trained and get the money, if you have to pay it by yourself. You don't get any money at all. During the training, the trainee works full-time and he is employed as a physician in the facilities. And normally you can be trained in each hospital, not only at the university hospitals, also you can be trained in private hospitals, also in clinics with other doctors. And it's full paid for you. Now the hurdle is for you to get the approbation, the license to work in Germany. And we call it the license, the license to work as a practitioner or as a doctor here in our state. And this license is requested from the Supreme State Health Authority. That means in each state we have in Germany, 16 as I told you, there is one office, and this office will give you the license. But to get the license, you are not trained in the offices of the state, but you get the license from the Chamber of Physicians. The Chamber of Physicians makes the examination, and this chamber gives the result of the examination to the medical office, and the office gives you the license, or the approbation, we call it. And there are a few possibilities. First of all, you have to fulfill another course to get the language knowledge. And for the language knowledge, you need also an examination. And the content of the language knowledge I will show you later. This is a course, it's our company intensive German language course for doctors. You need this course